This educational content is provided by Dr. Keshav Narain, a leading expert in retinal and optic nerve care at South Bay Retina. I bet you didn't know that stress could actually blur your vision. Have you ever noticed your vision seems off the moment you start your day, or seen a watery spot that won't go away? Many dismiss these symptoms as simple eye strain, but stress can directly impact your eyesight in surprising ways. Inspired by Dr. Keshav Narain's work, we'll explore Central Serous Chorioretinopathy, or CSR, a condition where stress and vision collide. CSR is becoming more common, yet remains misunderstood. Many patients are left anxious with no clear answers. The link between emotional stress and eye health is profound. Imagine trying to read or drive, but your vision is warped and distorted. These are real symptoms of CSR, where the central part of your vision becomes compromised, affecting daily life. Our high-pressure lifestyles keep our bodies in a state of chronic stress, flooding us with hormones meant for emergencies, not daily living. This can trigger fluid leakage into the most sensitive part of your eye. Understanding this connection is the first step to demystifying CSR and finding a path back to clear vision. Let's dive into what CSR really is and why it matters. So, what exactly is CSR? It's a condition where fluid leaks under the macula, the part of your retina responsible for sharp central vision. This fluid comes from the choroid, a layer rich in blood vessels, and lifts the macula, causing blurry or wavy vision. The main culprit, cortisol, the stress hormone. Chronic stress keeps cortisol levels high, making blood vessels leaky. High stress leads to high cortisol, which leads to fluid buildup and blurred vision. CSR is most common in men aged 30, 50, but anyone under significant stress can be affected. Your eye is literally showing the strain your mind is under. Recognizing CSR moves it from a mysterious problem to a diagnosable, treatable condition. It's not just eye strain, it's a physical response to stress. Understanding this empowers patients to seek real solutions. Next, let's look at why watch and wait isn't always the best advice. Traditionally, doctors told CSR patients to go home, reduce stress, and wait for the fluid to resolve. For some, this works, but while you wait, delicate cells in your macula are being damaged by the fluid. Even if the fluid disappears, vision may never fully recover. For those with recurrent or chronic CSR, waiting can mean permanent vision loss. The wait-and-see approach is now being questioned. It ignores ongoing damage and leaves patients anxious and powerless. Modern eye care demands a proactive approach to preserve vision. We need to move beyond hope and time and act to protect our sight. So what happens when stress reduction isn't enough? Doctors often recommend stress management, meditation, sleep, exercise, cutting caffeine to help CSR. For some, these changes help. But for many, especially with chronic CSR, lifestyle changes alone aren't enough. You can do everything right, but the fluid may remain. This is especially true for people in high-stress jobs, pilots, surgeons, traders, where stress is unavoidable. For them, just relax isn't practical, and blurry vision can threaten their careers. Relying only on lifestyle changes is risky for those with persistent CSR. The burden shouldn't fall solely on the patient's ability to control stress. When lifestyle changes fail, medical intervention is necessary. We need treatments that directly address the leakage and restore vision. Enter subthreshold laser therapy, a game changer for CSR. For persistent CSR, subthreshold laser therapy offers a safer, smarter solution. Unlike older lasers that burned the retina, this gentle laser stimulates healing without causing damage. It targets the retinal pigment epithelium, RPE, encouraging it to pump out excess fluid and restore the macula. The procedure is quick, painless, and doesn't leave scars. Traditional lasers risked permanent blind spots, but subthreshold lasers can be used safely even in the center of vision. This proactive treatment accelerates healing and reduces the risk of permanent damage. Patients recover faster with minimal risk. Subthreshold laser therapy addresses the core problem, fluid buildup, by working with the body's natural processes. It's changing the standard of care for CSR, offering hope to those who were told to just wait. But does it really work? Let's look at the data and a real patient's story. Subthreshold laser therapy isn't just theory, it's backed by strong clinical results. Studies show over 80% of chronic CSR patients see the fluid disappear within months of treatment. Visual acuity improves, with many patients gaining 1 or 2 lines on the eye chart. This means sharper vision for daily life, reading, driving, recognizing faces. Take Mark, a 45-year-old architect. After months of blurry vision and anxiety, he tried subthreshold laser therapy. Within 6 weeks, the fluid was nearly gone and his vision snapped back into focus. He returned to work with confidence, his career saved. Mark's story is one of many. This treatment transforms lives. Subthreshold laser empowers patients to take control, moving from passive waiting to active healing. For those in high-stress jobs, this is especially crucial. Let's see why CSR rates are rising in these professions. High-pressure careers, traders, surgeons, pilots, entrepreneurs are seeing more CSR cases. These jobs demand constant focus and create chronic stress, raising cortisol and risking vision. For these professionals, CSR threatens not just sight, but their livelihood. Avoid stress isn't realistic when your job depends on sharp vision. That's why advanced treatments like subthreshold laser are so important. Waiting months for vision to return isn't an option. Early decisive action is key. Don't ignore even minor vision changes. The sooner CSR is diagnosed and treated, the better the outcome. Modern professionals need modern solutions to protect their sight and careers. We've seen how stress can damage your vision and why waiting is risky. Your eyesight shapes your world. Protecting it should be urgent. If you notice sudden blurry spots, wavy lines, or dim vision, don't wait. These are warning signs. Seek expert help immediately. The longer fluid remains, the higher the risk of permanent damage. Ask your eye specialist about advanced diagnostics and treatments like subthreshold laser. Don't settle for outdated advice. Modern medicine offers real solutions. Take action to preserve your vision and your future. Your sight is worth fighting for. Act fast, seek the best care, and keep your world in focus. Safeguard your vision for all the years to come.